We'll get started with our questions. The first question, primarily for our doctor and dietitian, is from Becky, who wants to know, are there vitamins that will help me reduce side effects or do better?
So from a nutrition standpoint, with vitamins, I really think during treatment, the most important thing is getting enough calories and protein to help maintain your weight. I wish that there was a vitamin that, could solve all these side effects, but I think just getting in enough nutrition through food is probably one of the best things, and getting enough protein with every meal or snack that you have to help maintain your muscle mass. I think those are the most important things. And if you feel like you might not be getting all your vitamins and minerals through food, you can also potentially take a multivitamin if your doctor's okay with it. But nutrition and vitamins through food are probably the most important thing to consider.
All right, thanks, Alison. Dr. Ornstein, anything to add to that?
No, I completely agree. I generally don't recommend vitamins as a first line of defense or even a second line of defense. I think the natural foods that we have, and kind of listening to one's body. And the body will tell you what you need. Sometimes the body needs a little bit of a push, with the help of the doctor, with the help of the dietitian, with the help of the entire care team. But just trying to be consistent with meals and being consistent with the foods one was eating before the diagnosis and before treatment is usually sufficient for the general dietary needs that the body has. If there's a need for a specific supplement here and there, vitamin D for someone who might live in Cleveland and doesn't see the sun or something like that, that's a different story. But from a global nutrition perspective, just sticking to food and drink that we would normally have should be sufficient for nutritional intake.
All right, thank you, Dr. Ornstein. That kind of leads us right into our second question here from Howard in Philadelphia. Should kidney cancer patients have blood work to detect vitamin deficiencies?
So, there definitely are ways to check vitamin levels in your blood, but they're not the most accurate. I think, checking a vitamin D level is probably okay, but other vitamins aren't necessarily going to be the most accurate way to assess the vitamin level. So once again, I would say definitely just eating and getting the nutrition, vitamins, minerals from food itself. And if you feel that you're deficient in anything or you're not able to get enough fruits and vegetables, maybe you don't have much of an appetite and that's not something you're craving, you could consider a multivitamin. But in terms of checking levels in your blood, it might not be the most indicated thing to do.
Anyone else?
Yeah, one thing I would add is that I completely agree with that, but I would also tell you as patients and caregivers, you have a lot to think about. Patients who are even just on surveillance or patients who are on TKIs alone or TKIs with immunotherapy or on a clinical trial. There's so much going on. There's so much blood work, there's scans, there's visits, there's a lot. I wouldn't jump into putting more on your plate. So if there's a specific need for a specific vitamin check, okay. But I think getting a whole nother panel of vitamins checked when you're already getting your blood counts and your liver and your kidney and all those other things that are already coming through, I worry about adding more of a burden to you by having more blood checked and finding something that might be a little off, that might not really be of significance. And hopefully your doctor and your nurse and your advanced practitioners and your dietitians and your bigger care teams will be able to direct you if that's the case, or if you think of something, of course, ask your team. But I wouldn't go sort of being proactive to get a whole list of vitamins.